So what is the burden of hypertension in the US? So unfortunately, in the US, almost half of the population is thought to have hypertension. And we'll talk about the burden in men and then women. So in men, about 52% of men have hypertension, but we know that Black men have the highest rates of hypertension in the US and in the world to some extent, right? And white males have a lower prevalence of hypertension compared to Black males. But in women, we know that 43% of the population has hypertension. But again, look at the numbers for Black females. Almost 58% of Black women in the US have hypertension. And this is concerning. And this is why we need to do something about it, because we want women to live longer, healthier lives. So what about blood pressure control rates? So among people who have been told they have hypertension, we want to bring blood pressure down and make sure that it's controlled. And so if we describe or define control as less than 140/90, right? In 2013, only 54% of people had their blood pressure controlled. But that worsened in 2017 and 2019, where only 48% of the population was said to have controlled blood pressure. So this is using a higher cutoff of 140/90. So what about when we use a cutoff of 130/80? Well, it paints a pretty startling picture, right? So in 2013 to 2014, only 25% of people, US adults, were said to have controlled blood pressure. But in 2017 to 2019, only 19% of people had their blood pressure controlled. And this is why hypertension or uncontrolled hypertension is considered a public health crisis, right? So COVID-19 is on everyone's minds, but high blood pressure is something we should all be talking about and doing something about. So only 1 in 5 adults have their blood pressure controlled to less than 130/80. So when we talk about these disparities, I shared earlier that about 58% of Black women have hypertension. I talked about the fact that blood pressure control rates are poor. But the question we should ask ourselves is that why, right? And one thing I want you to walk away with, it's not just one thing. We can't blame patients for having uncontrolled blood pressure, right? There are different factors that contribute to poor blood pressure control rates. Our society, right, does not provide the necessary support for people to live long, healthier lives. There are people who live in food deserts, right, and neighborhoods that they don't have access to healthy foods, right? And so they're not to blame for that structure. There aren't adequate community resources, right? Within the healthcare system, there are issues that need to be addressed, right? There are staffing issues, teams don't function well, health systems are not reaching out to the community. And at the clinician or staff level, clinicians are not perfect. Sometimes when someone's blood pressure stays elevated over time, clinicians do not act to either make changes to their medicines to understand, are they being adherent? They are not actually intensifying treatment when it's needed, right? So that's also why blood pressure control rates are poor. They may also not have the right communication skills in terms of interacting with patients from different backgrounds. And so that's why we emphasize training, right? Cultural competency, cultural humility, right? Knowing how to interact with people in a respectful way, right? That allows them to be honest about their unique challenges. And at the patient level, we know that sometimes people have low health literacy. They may have unhealthy lifestyles, but these unhealthy lifestyles are a result of the environments that they find themselves in, right? And their medication taking habits. So I want you to walk away with the fact that, yes, there are things that you can do, but there are things that the society overall can do to help people live longer, healthier lives, right? We need to change the structures in our neighborhoods and our communities that allow people to exercise safely, to eat healthier, right? So we all need to do our parts.